Love this quote. In the absence of clearly defined goals, we become strangely loyal to performing daily acts of trivia. I remember years ago I went to a Stephen Covey seminar, and he's got the 4 quadrants that you sort of focus on, and one of those really talked about how we sometimes allow the trivial, urgent things of the day to take us away from that which is actually most important that we should be focusing on. And I think that's probably one of the biggest values of goal setting, is it allows us to really kind of, hopefully, if we use goals correctly, helps us to continually sort of reset and go back to that place of, wait a minute, what's most important. I think oftentimes, I don't know, maybe I'm the only one, but the volume of email and phone calls and questions and things that come in the course of just one day can oftentimes derail us from getting at where it is we really want to go. So being able to set goals, and then Catherine's going to talk to us about how we align and keep them fresh, but keeping those in front of ourselves and in front of our employees, I think, can be one of the things that can really help us make sure that we don't get too caught up in the daily acts of trivia, so that a year from now we look at each other and say, yeah, remember when we went to that goal setting class with Kim and Catherine, and these were the great things that we were going to do? We're hoping that, again, setting 1 to 3 really specific and important goals will help us all really accomplish it. So this goes to what I had alluded to earlier, which is the method of goal setting that we are adopting. Many of you are probably familiar with the SMART goals. I would say simple goal is very, very similar to the SMART goal concept, the whole idea of being very specific. So oftentimes, and I think particularly when we're talking about department goals, it can be easy to get lost in some really big sort of lofty kind of a thing, right? Institutional goals, we assume, are going to be rather big and lofty, right? Those are sort of our goals, our values, the big picture of where we're going. But when we start to look at things at the department level and then at the program and individual level, this is where we really need to get specific, concrete. What are we really talking about? Not just like, we are going to make sure that our patients really like us. Okay, but we need to get really specific. We want to enhance our patient satisfaction scores by 5%, I don't know, whatever's realistic for the area that you're in. So specific, what are we going to accomplish? And we're going to increase those patient satisfaction scores by, okay, and then filling in that blank in terms of what that might be. Important. So I think that, no pun intended, this is probably the most important part of the model, because we can set goals around just about everything or anything. But what we really want to be setting goals around is that which is most critical and most important. So that goes back to that SWOT analysis, that goes back to where are we heading, what do we really want to accomplish, and make sure that we're setting goals around that. I will tell you that as leaders, as you are interacting with your employees, I think important is really important. I may want to take an Excel class and learn how to do pivot tables because I think it would be really cool. I saw someone use them in a meeting and I think they'd be really cool to know how to do. But is that really important? Is that really moving us towards where we're going in the direction that we're going? So I think if there's anything in here that we're really focusing on, this is a key one, especially when we're talking about 1 to 3. Right? If we were setting 10 or 15 goals, I'm not sure it would really matter. Let's just throw a bunch of goals up there and hope we get them. But if we're doing 1 to 3, we got to make sure they're the right ones, and then they need to be measurable. We need to be able to come back together a year from now, sit in this room, and say, Kim, here's how we met the goal that we set. We know this by X metric, or the fact that this happened or that happened. Okay? So, usually a specific goal will answer the W's. What are we going to do? Why are we doing it? Who's going to be involved? And then there might be a where There might be a location or a program or something specific that you may put in there as well. But I think as you're actually looking at writing this, even putting that out for yourself, what, and then answer that question. Why? Answer that question. Who will be involved? Okay? So, as sort of an example of, improving internal department communication, right? That sort of falls in that category of probably too general, okay? It's a good goal. Again, if we look at our engagement surveys, that came back loud and clear that people didn't think that there was good communication sort of throughout all levels of the organization. But a better goal might be we're going to improve department employee engagement through increased two-way communication, as evidenced by increasing scores by 2% on the next employee engagement survey. Okay, we're hoping to run another employee engagement survey this year, so I think that's a valid metric. If employee engagement is one of the things you really want to look at in your department, I think we're going to run another one, so that would be a good metric that you could use. All right, so we get the idea, right? You really want to be able to build your metric right in there and have it be very specific. And it still needs to be realistic. So you realize I didn't say we were going to improve engagement by 15%. Right? Okay. In a year, the things that we've done in our areas to improve employee engagement, you're not going to see, an increase of 25 percentage points. It takes a lot to move that needle. So you want to be able to do something that's really going to be realistic. So if a goal is important, we talked about this, again, some questions that you might want to ask yourself to sort of test. Have I really written an important goal? Is it worthwhile? Is this the right time to do this? So this one, we've been, again, going through this exercise in the Office of Human Resources, and we put 10 things up. 10 major initiatives, 10 big things that needed to happen as a starting place to begin to say, okay, what of this now do we need to flesh out into our goal? And this question, is this the right time, actually took about 4 of those things off the list. They are good things to do. They are things we will likely need to do at some point, but the current context, the current environment, the other competing things that were up on the list that need to be done, knocked some things out and said we'll put these up again next year and see if they might be the right time. And then does this match MCW and your department's other efforts, where we're going? Again, it goes to that whole alignment thing. Or are we just off doing something that sounds really cool but doesn't align with where we're going? I will say that I think, again, as leaders, that will likely be your challenge as you work with some of the individuals. You're going to have a couple of different options. One is to really sort of tell your department this is what we're all going to focus on and push that goal down. The other would be to have individuals write their own individual goals, or you may have people do a little bit of a mix of both. But I think in terms of the match piece is probably the most challenging when you allow employees to write their own goals, okay? Because sometimes they come up with some really cool things, but they're just not at all in the direction of where we need to go. All right, so a measurable goal will usually answer these questions. So again, as you're sitting down and you're looking at crafting your goal, I think these are just very practical questions that you can put out. Okay, how much, how many, how will I know I was successful? Okay, so the old adage, what gets measured, what gets done. So a measurable goal is either going to be quantifiable in some sense. Okay, in the communication example, I said, increase by 2%, or there's going to be some sort of frequency in there. So if we go back to sort of the patient satisfaction piece, maybe for all of the frontline individuals that engage, who are the first engagement, maybe it's going to be that with every patient, they're going to smile, greet them, and ask them how their day is, and then every patient that comes out, they're going to ask them how their experience was. Okay, so some sort of frequency that you put in there, or it could be some sort of quality metric. Okay, according to guidelines, according to customer service standards, according to whatever it might be. Okay. So we're now going to begin to talk about how we really best facilitate this whole alignment thing that we've been talking about. How do we make sure that the institutional goals, the department goals, and the individual goals are aligned?